Welcome, everyone. I'm Nancy Lee, Senior Policy Fellow at the Center for Global Development. Thank you so much for joining this conversation. We have an exceptional panel for you today that includes leading innovators in finance, health and education research, and business models that work in low-income environments. We have with us today Alex Swain, who's CEO of the Global Innovation Fund, which invests in evidence-based innovation through early-stage debt and equity and grant making. James Habyarimana, Provost Distinguished Associate Professor at Georgetown's McCourt School of Public Policy. Josh Bicknell, co-founder and CEO of Balloon Ventures, which supports small and growing businesses with early-stage investments, expertise, and growth capital. And Farouk Merali, founder and CEO of mClinica, a mobile platform that connects pharmacists, healthcare providers, healthcare companies, and patients. And we want to bring you in the audience in later in the conversation. So have your questions ready. If you do have questions for our panelists, please submit them either by email to events@cgdev.org or tweet them at cgdev, #CGDTalks, or submit your comments via YouTube. So to begin, I hardly need say at this stage that we're having this discussion at a time of huge global uncertainty. I would say the list of unknowns is perhaps unprecedented in all of our lifetimes. We don't know the course of the pandemic, the shape of the economic recovery, how the crisis will reshape critical sectors like retail, tourism, health, and education. We don't know the path of global private capital flows, which collapsed to emerging markets in March and then bounced back considerably in April. We don't know whether we've entered into a period of sustained risk aversion or if low interest rates in developed countries will actually spur a global search for yield in frontier markets. And we don't know the future of global trade, whether it will recover rapidly or remain depressed. But here's what we do know. We are seeing a tragic spike in poverty, including among vulnerable populations that had recently risen out of poverty. We will also see likely a spike in inequality, and both those will have significant political and social consequences as well as economic consequences. We know the most vulnerable populations will suffer the most, those in the informal sector and rural areas and remote areas, those often not reached by government programs. Women will be especially affected, given that they're disproportionately represented in the informal sector and in personal service industries that have been hard hit by the crisis. We know that low-income countries and lower middle-income countries will be much harder hit in this crisis than in the global financial crisis by the drop in external demand, exports, commodity prices, steep drop in remittances in many countries, the collapse of tourism, and in many countries by serious debt problems and financial instability. We know that for those countries, their approach to balancing health and economic objectives will likely differ from those of higher income countries, partly because of younger populations and the differential health effect, but also because of tighter fiscal constraints and decisions driven by stark economic necessity. So we at CGD have been thinking and writing a lot about what all this means, including for the publicly funded international financial institutions. The IMF, the multilateral development banks, bilateral development finance institutions, the world is looking to them for a rapid and massive crisis response. The emphasis so far has been on a huge increase in their lending to the public sector, to embattled governments. But what about the role of blended finance? That is the combination of public and private finance, commercial and concessional finance, to the private sector in particular. Can the development finance institutions that finance the private sector play a major role as first responders to the crisis? Should we continue to prioritize use of public funding to catalyze private finance? My answer would be yes, but not everyone would agree. Many would question, with some justification, the capacity of the development banks and development finance institutions to, first of all, manage the increased risk, second, effectively find and fund innovation, and third, bring their public and private finance tools together effectively to provide income support, jobs, and services to the most vulnerable. I've argued in the past that the financial model of these institutions is actually not well suited to managing exceptional risk. To boost their development impact and their ability to mobilize capital, they need to partner, in my view, with new risk-tolerant off-balance sheet capital structures that have different financial goals and a different culture. That was the idea behind a proposal that we made for the Stretch Fund, which is actually quite similar in concept to the Global Innovation Fund. It seems to me that the arguments for such a structure have only gotten stronger in the wake of the crisis. So this panel will address two basic topics: the role of innovation in improving access to health, education, and decent jobs, and second, the role of blended finance in supporting innovation. So with that, let me turn now first to Alex, who's perfectly placed to frame these challenges and the right kinds of solutions. So Alex, if you could give us a sense of how the strategy of the Global Innovation Fund is adapting and changing to respond to the crisis.
Thank you so much, Nancy. It's really great to be here with this crowd of folks. And I think you've led us on the path to sort of exactly the right questions that we as a community need to be asking ourselves. Part of what it really boils down to is how do funders, impact investors, anyone with capital support innovators, not only to address the immediate public health crisis, but also the longer term economic recovery. Those things, as we're learning here in the US and in other developed countries, are two sides of the same coin. Because of how GIF is structured, we've been able to pivot and fairly quickly commit up to $20 million of our fund to help finance innovations contributing to response and recovery. To bear risk smartly, and I think you laid out the just extensive and nearly overwhelming risk that we're collectively facing, we're going to need a mixture of different kinds of financing, relying both on our ability to do grant making as well as debt and equity investing. We're going to need to target multiple sectors and regions and have a framework for assessing impact and for sharing lessons amongst ourselves in a community, given all the uncertainties that you've laid out. And I'm very excited to hear from entrepreneurs who are actually working on the ground and dealing with these challenges today as we think about, from somewhat removed, how to best support the innovation agenda on both health and economics side of the COVID response. So here at GIF, we have, and we've laid this out a bit in the paper that CGG posted with this event, we are very keen to support the public health response. We know that not all the interventions that work in more developed countries will work in developing countries. And we want to be very open to the local context and solution as to what's the best response and how we can make behavior change easier to adopt and sustain. On the economic side, we need to meet the needs of entrepreneurs working to rebuild markets. And we need to be seeking, as you laid out, Nancy, innovative financial vehicles that can avoid liquidity crunch, bear risk, and provide subsidy when the case for subsidy is strong. We really do face the peril that we will wipe out decades of investing for social impact if we don't figure out how to do that well. We believe that you need investment from across the returns continuum. Of course, we need to invest enormous amounts of money in vaccines and therapeutics. But beyond that, there's an innovation and financial innovation agenda that spans grant making, impact investing, and maybe a new way for the DFIs to work. So at GIF, we've settled on 4 principles that are driving our investment decisions in the new reality. First, in the economics of pandemic response, our agenda should be rooted in what we know about human behavior and how to make technology adoption easy and easy to sustain. So we need to apply that lens of behavioral economics to questions around driving and accelerating hand washing and mask wearing, and ultimately vaccine take-up. James, I think, will talk more about this, noting, of course, that the local context continues to matter a lot, even if we think there are some universal lessons we can draw from. Second, we want to invest to protect livelihoods during this mitigation phase of pandemic response. I think all of us have seen a huge increase in cash transfers during even this relatively early stage of the pandemic, made possible by mobile money penetration. With GIF, we're also interested in whether mobile phones can be platforms for mental health counseling, prevention and mitigation of gender-based violence, and ed tech as well in the next phase of response. And third, as you've talked about, Nancy, government and NGO action must be complemented by decisive action from private sector and DFIs. Investors and creditors need to protect their portfolio firms and provide liquidity to see partners through this period. Unlike maybe other financial crises in the past, this is not a period in which we really have any reason to believe that low productivity firms will be hurt the most. The pain is somewhat random, so the case for intervention and the case for subsidy is strong. I think that this requires a new way for DFIs to think about risk and risk exposure. Take just one example of e-commerce companies in Africa. Maybe a company that was just about to raise a round of equity and so happens to be short on cash. Well, not only is that company providing real social value right now, but there's reason to believe that actually e-commerce might be really accelerated as a result of the pandemic. And so in the longer run, their position may be strengthened. But if they're out of cash right now, they could very well fail to survive this immediate period. Those are the kind of companies that we need to be really alive to the possibility of how to provide them concessional finance. Because those kind of companies going out of business isn't the creative destruction of capitalism working effectively. It's social value destroying. Now, sometimes we hear from colleagues in the development finance sector that we need to take a cautious stance towards risk to be ready for that rainy day. Well, now is the rainy day. And so we really need to put aside business as usual risk return trade-offs. I'll give another example from the GIF portfolio. We're invested in a company called Where Is My Transport, which develops products to help people plan journeys using informal transit. Well, Where Is My Transport, as you know, they published a really nice piece themselves just earlier this week, where they are very transparent about the fact that they're facing a lot of pressure now as people hesitate to share rides. But they also have this emerging sense that this disruption will actually create new opportunities and solutions to help essential workers and improve their commutes. We want to make sure that we're good partners to Where Is My Transport during this period of time while they get their hands around the contours of what that disruption means for them. And then, of course, there are some companies that can directly contribute to pandemic response, and we're using our grant-making capability to support that. I was pleased that fairly early on in the pandemic, we were able to approve a grant to Clinica, Farouk, the CEO, is here with us today, to add a COVID response element to their work. And I hope Farouk will share a little bit about that and what that experience has been like. And then the final piece of the puzzle from GIF's perspective is the need for new concessional vehicles, as you talked about, Nancy. As we think about recovery, we're going to continue to need to be able to bear risk and potentially radically reduced market returns for some period of time. So those of us who are working at that edge of blended finance or with public money need to think about vehicles where we can deploy capital that crowds in commercial money alongside more deeply concessional capital. We're going to need an impact framework that allows investors to understand trade-offs between financial returns and development impact. We should be ready to be pretty forward-leaning in our investment stance as we understand the new value chains and markets and regulatory frameworks that are going to have evolved during pandemic response. Just one example of that, another company we work with called Pagatech is a sort of PayPal and mobile money company in Nigeria. Over the past 2 months, Paga has seen more than 200% quarterly increase in users of their mobile wallets and has doubled to some 14,000 the number of merchants that will accept payments on their platform. We want these companies to be able to quickly be back in a very forward-leaning stance, backed by the money that they need to do so as we emerge from the first stage of the pandemic. And of course, the effectiveness of this work by relatively smaller investors like GIF or other impact investors depends a lot on the macro conditions and what the larger multilaterals do. I don't know that we'll talk so much about that here in this meeting, in this chat today, but Nancy, I know you've done thinking about that in the past as well, along the lines of the stretch fund. The case for these vehicles, as you say, is in some way stronger than ever. So I'll just conclude now by saying we've all got a lot to learn together. It's great to be in this first conversation, and hopefully lessons that we learn while we think about what works in developing country pandemic response and recovery can also inform what happens in our interconnected world. And if you want to hear more about GIF's portfolio, on our website, we've just launched our 2019 impact report. And with that, I will send it back to you, Nancy. Thank you so much.
Thanks, Alice. That was a great start, and I want to come back to you about these points you raised with respect to thinking about risk-adjusted return in this new environment, how you make decisions in your investments with respect to returns, and also how you allocate subsidies to address the heightened risk. So, but we'll come back to that. So now I think let me turn to James, and let's talk a little bit about research. And it would be great if you could talk about research in health and education in particular, and how that research can inform recovery efforts. James.
Sorry about that. Thank you very much, Nancy. And thanks to you, Alex, for that wonderful introduction. I think 10 minutes is not enough time to talk about kind of the wide body of research that can inform the kind of innovations that we need today. So I'm going to try and sort of be fairly narrow, and perhaps we can come back to some of the other issues later on. I think the first thing that kind of just want to build on something that Alex said, which is to say that, in some ways, the innovations that we need today need to be local. They need to build on information that innovators on the ground are generating. And in some ways to essentially kind of, aggregate a lot of new ideas into sort of more effective ways of addressing the pandemic. I think in some ways, when we think about what people are talking about, the innovations people are talking about today, there's kind of a great emphasis on therapeutics, on vaccines. But in some ways, those things may be a little bit further away down the road than we all think or would like to be. And we really need, any recovery is going to rely on a great degree of public confidence. Workers need to feel safe traveling to and from work. They need to feel safe at their workplace. We need to be comfortable that our kids are safe in school, and then consumers need to be comfortable spending money. And so in some ways, I actually like to sort of try and sort of focus on what I think kind of is a big need and demand for innovations in just being able to produce and generate this public confidence. And I think there are two reasons for that. So we see a lot of variation around the world in how countries are actually sort of managing the pandemic. And I think that already sort of provides some indication. There's, every week there's an article that's trying to explain, why New Zealand is doing so well, why Germany and why South Korea is doing so well. And it strikes me that there's a big demand. And in this case, there is a kind of a really important sort of collective action problem that we all need to be successful in keeping the reproduction number of this disease as low as possible. Okay, so we're learning much more about the disease. We're learning a lot, about new symptoms. We're learning, just when people become infectious, and that in some ways is a kind of an opportunity to essentially kind of try and build some innovative solutions around essentially kind of building this public confidence. Okay, and I see two major kind of buckets of innovation around which I think economic and financial innovation can be very helpful. Okay, the first is in thinking about sort of the testing, tracing, and the quarantine that we need to be able to essentially kind of reduce the transmission of the disease. For the testing, I think this is something that we've struggled as a global community to sort of produce reliable tests in the quantities that are essentially kind of required, so for us to be able to go about our business, in the confidence that in fact, we know that we're sort of relatively safe. And I think this is where ideas around, say, advanced market commitments to essentially kind of produce lots of different tests that are faster, available. We'll need to essentially kind of solve a lot of problems about sort of manufacturing these things at a scale that is required. I think we're in a kind of very unusual circumstance where everybody in the world needs these things, and everybody needs these things in large quantities. Okay. In many developing countries whose kind of progress I'm tracking, they're only able to do something like 2,000 to 3,000 tests per day. And that does not seem to be sort of anywhere sort of close to be enough to actually sort of address, I think at least to build the public confidence that a recovery is going to need. So on that side, we certainly need, some, I'd say this is not kind of local innovation, sort of think of this as largely kind of, innovation at the global scale to sort of kind of provide effective tests, diagnostic equipment, and to distribute it widely. The second is, on the tracing and quarantine, and Alex alluded to some of the some of the technologies that are available, and in fact, even some of the innovators seem to be increasing their scale. So mobile platforms provide a wonderful opportunity for governments to provide social support. I think compliance to any quarantine, compliance to any lockdowns, in some ways is predicated on just how comfortable people are going to be, essentially kind of staying at home. And I think we need a range of technologies and innovations to make that easy, to make it easy and comfortable for people to stay at home. And mobile platforms, ID for development. There's a series of ideas, I think, out there that in some ways need to be aggregated into essentially kind of some successful solutions. And then, of course, on the tracing, we've been hearing a lot about technology. Google, Apple, Bluetooth. There's a wide range of things that are going to work very well in some environments where people have smartphones. But in some ways, there are a wide range of other solutions that can work elsewhere, because the one technology that is in some ways quite widespread and is the mobile phone. So even in the poorest countries, people have access to feature phones, at a level of, say, close to 80% of the population. And so there's clearly some room for important public-private partnerships between, say, mobile phone providers, the government, in some ways to sort of come together and actually sort of build, solutions that will make it easy for people to comply to any quarantine and testing regimes. Now, we've also heard a lot about concerns around privacy and ethical sort of issues associated with using these technologies, and so ultimately these solutions need to be able to address those issues and build in a lot of sunset clauses and important and in some ways get the trust of the public that they can in fact do this without abusing these privileges. So that's on the kind of the testing, tracing. We certainly have a lot of research that can inform how we sort of select, train, and deploy these testing and tracing units. I think we're hearing a lot about countries, mobilizing a lot of these groups. what in some ways what we need to know and what we need to be able to share quickly is how well these different strategies are working in different contexts. If you take the cases of, say, Liberia, Sierra Leone, the Democratic Republic of Congo, these are countries and systems that have some experience with doing testing and tracing, mostly kind of from the Ebola experience of a few years ago. And in some ways, I feel like the innovations we need to build on those experiences, but also to be able to crowd in digital data, say from search sort of queries, or from essentially kind of the cell phone cell phone use as well. We also need to in some ways rely on kind of social network theory to sort of understand how individuals are connected and who might be the influential individuals that we need to convince to actually sort of allow these testing and tracing teams to have some access to communities. I'm sure some of you have seen videos of testing and tracing teams being chased out of communities in certain parts of the world. And so in some ways, there is a kind of a really important sort of trust building that needs to take place alongside this for us to be able to identify infected individuals, isolate them, and hopefully sort of reduce transmission. And then finally, we also need to sort of think about addressing stigma. So as with a lot of new diseases, and in some ways we have the experience from 30 years ago of HIV, is it's quite there's an immediate stigma. As soon as somebody's identified as being COVID or having the coronavirus, it's very, very hard for them to be integrated back into the community. So there've been lots of cases where individuals can't go back to their houses. And of course, once people know that, then the likelihood that they'll come forward when in fact they're sick is very low. And so there's really kind of important sort of set of innovation and public campaigns that we need to sort of engage in to address stigma. And then the second bucket is, and this is something that Alex had talked about, and I know I'm running out of time, but let me see if I can sort of very quickly sort of describe kind of the research there. So there is kind of a lot of research from hygiene and sanitation, malaria, HIV, voting behavior that in some ways informs the kinds of innovations that we need to sort of produce new behaviors that will reduce transmission. So Alex talked about hand washing, but in some ways we also need to think about sort of mask use and not just having a mask on your chin, which is if you see a lot of pictures around the world today, there are a lot of people who have their masks, but they're essentially kind of not using them correctly. And then ultimately you also need to think about how we try and change some rituals where people get together, and in some ways those events become super spreader events. And in some ways, at least the traditional and behavioral economics has generated a wide range of insights about how we can actually sort of produce these new behaviors. And I probably won't have time right now, but let me just say kind of three things about sort of what this research seems to suggest. And in some ways, there are three kind of domains that are simultaneously addressed, and hopefully Farouk and Josh may be able to add to some of this as well, which is that the first thing is we want to sort of try and motivate individuals to essentially kind of change their behavior. And so we actually sort of want them to change their beliefs about sort of why hand washing or wearing a mask, which is uncomfortable, is essentially kind of a good thing. The second is in some ways sort of to deal with, what is the cost of actually sort of engaging that behavior? How much do I need to learn about the sort of the right way to do something? And what are the sort of complementary inputs that I need? And here, this is where in some ways, innovations around kind of prices and incentives essentially kind of have been powerfully used. And then the third is, that in some ways, even when people know what the right thing is to do and essentially kind of have, easy access to it, we need to sort of prompt people, right? So we walk around with, attention problems, and it's sort of usually helpful to actually sort of have some prompts, some features of the environment that actually sort of lead us to actually sort of engage in the behavior when we should do. And, there's quite a wide range of research that actually sort of helps in sort of pointing us in the right directions. And I certainly hope that these innovations can build on these insights as we go forward. But just to kind of wrap up, the really important things is to say that we really need to build public confidence today in order to essentially kind of have a recovery. And in order to essentially kind of preserve a lot of these, the social value that is essentially kind of being supported by a lot of investments by the GIF and other social impact investors.
Thanks, James. That's great. It's really it's thought provoking. I mean, we have you've basically laid out the need to build both trust and confidence, but also make it easy for people to comply with socially beneficial behavior. And you can see in many places of the world you don't have either of those things. So, but it's very helpful to think about it in those terms. Okay, so now we're fortunate to have two people who understand what it looks like to businesses on the ground. And maybe we can start with Josh. So maybe you could tell us a little bit about what's happening to the businesses that Balloon Ventures support, and maybe if your strategy is changing, what direction it's moving in. Josh.
Sure. Thanks, Nancy, and hi, everyone. So my name's Josh Bicknell, and I'm the co-founder of Balloon Ventures. So our goal is really to unlock the missing middle of SMEs, and our focus at the moment is Kenya and Uganda. So just to give a bit more context about that, we typically work with businesses employing 5 to 15 people, and they're working in very traditional brick and mortar industries. And really these businesses, they should grow and be the engine of good job creation, but unfortunately they get stuck. And they get stuck for a couple of reasons. The first thing is access to finance. So typically they're deemed too high risk for current investors in the market. But the second thing that's linked to this is that often their operations are just too informal. So they don't have the foundations to grow. And so that's really where we're trying to come in. So we have a team of local staff, and they work with these businesses through a very standardized journey using technology to try and create these solid foundations from which they can grow. So things like good financial management, HR, planning, things like that. And we try and encourage these entrepreneurs to adopt these behaviors, and we do that at low cost. And so through implementing that good management, we can then reduce the risk and increase the return of these businesses, and so take an unviable group and make them viable. And we then invest typically $15,000 to $20,000 in these businesses. And they repay that money, and they repay for the support they've received. And so we're trying to build a model that is wholly or as close to possible financially sustainable to unlock this group where others haven't managed to do it. And our mission in all of this is really creating good jobs. So making sure that entrepreneurs build businesses that offer employment where it's fairly paid, it's secure, and it's safe. And so linked to today's title, we are really trying to push a financial innovation that we hope one day can unlock the potential of many, many small businesses to grow and create inclusive economic development. And we've been testing and iterating the model for 3 years. And pre-COVID, we were seeing very positive signs. So we were up to 61% financial sustainability. We were creating 6.3 full-time jobs per business, and we had a portfolio of around 30 companies. Obviously, in the last 3 months, things have changed quite a bit. So I thought, firstly, to think about how to restart those flows of capital, I think it's important to understand kind of what we're seeing on the ground and what we're experiencing. So the first thing is that around 50% of our portfolio of businesses initially closed. So sectors, though, were impacted very differently. So agricultural processing, generally those businesses stayed open. You then had, and they were unaffected. You then had other businesses where they stayed open, but demand was really down. And then you had a third set, which was the majority of businesses where they had to close entirely. So things like hospitality, tourism, they obviously couldn't open. In response, we and many other investors in the region granted loan holidays and restructured most of these loans because the businesses just simply couldn't afford to pay. We saw that most businesses, that they have less than about 6 weeks of cash reserves remaining, and many are eating into that to live and survive as entrepreneurs. And so in response, many are downsizing and they're trying to renegotiate or to negotiate for rent holidays, as these are the major costs. This may save a large number of businesses, but it also means that when they come back, they'll be smaller, so there'll be larger or greater unemployment. But interestingly, we're now seeing a gradual reopening of businesses. And I think it's obviously very hard to predict the future, but the feeling of our staff and entrepreneurs is that the lockdown can't remain because of the lack of welfare. People just simply have to go back to work. And so that's really what we're seeing. The towns and cities where we work, like Nakuru and Mbale, they have about 100, 200,000 people. And really the center of those cities are back to what they were like before, minus a few businesses that are still closed. And I think, like in the shutdown phase, in this reopening phase, different industries will be impacted differently. So those, for example, relying on cross-border trade, international travel, are going to be probably impacted for a long time negatively. But at the same time, we're seeing a growth in demand. There'll be trends like onshoring as demand grows for locally produced goods and services. And so we're trying to direct our support to help those businesses that are really struggling to maintain and survive, but also reopen and start investing in those businesses that are growing. I think more broadly, moving forward, that there are 4 really important points I want to make today and tough decisions that need to be taken. I think that the first thing is focus. So it's very easy to forget about these micro and small entrepreneurs. You know, they're not taking part in demo days and incubators and accelerators. And so it's very easy to forget about them. But actually, this is how the overwhelming majority of people survive. And at the moment, these businesses are disproportionately important. If you think 70 to 80% of people in Kenya and Uganda are working in these kinds of businesses, then they are the social welfare net of the countries where they work. And if these businesses fail, then millions of people will be pushed into poverty. And the risk is there. You know, Andy has done a recent survey and they estimate that 42% of small businesses are at risk of failing in the next 6 months. So I think that's the first thing, just not to lose sight of that focus, that these micro and small enterprises are absolutely critical in this. The second thing that we're seeing, and I'm sure this is repeated everywhere, is that every business is looking for money. So absolutely everyone wants money to restock and restart. But there's some important things here. So loans and debt, especially when they're expensive, can be exploitative and unhelpful. And what we're finding is that there's a challenge to really distinguish between issues of liquidity versus issues of solvency. So some businesses just simply are no longer viable, especially with demand down. And so saddling them with more debt is obviously unproductive. But also there simply isn't enough money to go around. And so money needs to be targeted at those businesses that can survive and can grow in order to efficiently avoid the worst effects of this. I think the third thing is, especially in the sector where we're working, you know, we have to be real with ourselves, that we're talking about a part of the market already massively underserved by financial institutions. So the IFC estimated that, you know, pre-COVID, there was already a missing gap of financing to SMEs in Africa of about $330 billion. And that was pre-COVID when the risk was lower. Now we're post-COVID, obviously the risk is much higher. What we'll probably see is banks and MFIs and other investors moving to higher margin groups that are potentially safer. And so businesses like ours pursuing innovations and trying to support these groups can only continue if there's a supply of affordable and patient capital. And I think this is probably obvious for a lot of people on this call, but just to kind of reinforce the point that there is a direct chain from what you can do, from your cost of capital through to who you work with, through to the impact that you can achieve. So I know that we personally can't work with some groups because the unit economics just don't work, the margins aren't there. And we're working within a segment where all the other investors can't work because they can't make money out of it. And this doesn't just happen to us, this happens to social enterprises across all sectors, where, you know, we're constantly juggling these financial returns and impacts. And I think for too long, I've felt that it's very difficult to make both financial and social returns equally. There's a trade-off. And I think for too long, people have claimed that you can do both. And I think at the moment when demand is down, like risks are up, inequality is growing, I think we all have a duty in this sector to really talk more honestly about this and to almost have a reset that there will be trade-offs. And if we want to protect the most vulnerable, then smaller financial returns might have to be made. The fourth thing, and I know I've talked a lot about money, but money isn't the only thing. I think it's very easy to get fixated and think about money when thinking about small businesses. But as I mentioned earlier, one of the fundamental reasons why these businesses aren't growing is because they don't have the foundations there. So when you think about how do you mitigate during this crisis, things like cash flow forecasting, right? If a business isn't doing that, they don't have the tools to really mitigate those risks. And so if you then pump money into those businesses, that money, again, is not going to be used efficiently. This is what we're trying to do to improve those behaviors. There's a lot of research around what doesn't work, unfortunately. So we're kind of pretty sure that classroom-based training doesn't have a huge impact. We're less certain about what does work. Our belief is that it really lies in behavior change. You know, what you're trying to do here is not necessarily introduce very complicated concepts, like financial management isn't so difficult to do. The issue is really behavior change, so getting people to want to do it. And there's lots of other interesting organizations working in this space. And I think accelerating that is really critical in order to drive the economic recovery. And then I think just finally, I just wanted to speak about just three things, I guess, from our own personal perspective as a social business, trying to grow and survive through this crisis. And what we're seeing. I think the first thing that I think is a concern is drift. And so by this, what I mean is there are lots of funding opportunities, there's lots of calls and proposals, and actually people are being encouraged in many ways to pivot. And I think there's a big issue for organizations that are struggling financially to start chasing money. And what this will end up with is money being used very poorly. My feeling is that we personally, we've had the success that we've had because we have a strong core and we focus on that. And so I think investors have a real responsibility here, sure, to enable flexibility, but also to support portfolios to focus on what they're good at and to continue driving the solutions that they were doing pre-COVID that were working. The second is fundraising, and Alex touched on it briefly. There's issues if you've kind of secured funding rounds, but there's another issue, which is most entrepreneurs will have built projections and forecasts and a series of assumptions that they're trying to reach in order to hit that milestone and raise the next round. And unfortunately, what COVID has done is it's just come and smashed all of those assumptions, right? So we're at 60% sustainability. Next quarter, we should have been at 70%. And obviously now we're going to be nowhere near that. So, I think there's businesses doing exciting things like us that should, I hope, continue and survive and do what they're doing, but they can't reach those milestones to raise their next round. So I think funders really need to be aware of that and support their fund portfolio through that. Then the very final thing, I think, is risk and uncertainty. So, as a business, we're used to dealing with risk, right? We do it a lot. We try and project risk and we mitigate it. But what we have something now is totally different, right? There's so much uncertainty that planning actually becomes very, very difficult. And so I think investors and financiers, they need to be flexible and accommodating of this and understand that actually there might be more things that don't work perfectly the first time. But if businesses aren't allowed to experiment through this while still sticking to their core and what they're good at, then I think we're all going to be poorer for this on the other side, because a lot of the innovations that could work and could break through will never actually get a chance to do that. So thanks everybody.
That's really great, Josh. That's a great, it gives a great sense of the landscape at this stage, and really take your point with respect to being honest about what returns are possible within certainly early stage businesses, but also innovative businesses, and whether impact investors really can have it all, market returns and high development impact, and we should come back to that. But now, Farouk, okay, you have an entirely different kind of business, but it's a business that's squarely relevant to what's going on. So tell us what's happening with your platform and the participants on the platform.
Great, yeah, so good to be with you all today. I'm actually joining you from Jakarta, Indonesia. So I was all day with the Ministry of Health, so coming in straight from the field. So what I thought I'd do is actually share with you how we are helping to address COVID-19 with a myriad of partners, whether they be capital or technical partners, and responding to this. And I think Joshua, raised a very good point, which is, it always was core for us to address these types of public health challenges We were doing, NCDs and TB and HIV/AIDS. Then COVID came along, and it was about mobilizing for that. And it was very much for us on core, and our ability to mobilize very quickly was certainly what allowed us to be part of this sort of response to COVID. So what I thought I'd do is share with you some of our slides. So I'll just share my screen very quickly here. I hope you can see that. Yeah. Very good. So I will take you through how we are actually handling the response for COVID-19. And we at mClinica really focus on the pharmacy. And our belief has always been that pharmacies are incredibly critical to public health. They are oftentimes the primary healthcare provider in many communities, especially in lower and middle income countries. And even more so in COVID-19, what's been interesting is we have found that actually pharmacies have received more volume than ever before. And one of the critical reasons behind this is that patients don't want to go to hospitals and clinics. So actually, if you look at hospital admissions, generally they have fallen. People are pushing off elective procedures, pushing off primary care visitation, and actually funneling into the pharmacy. So at this critical time, pharmacies, not only were they in normal scenarios very critical to public health, but they're even more important now. And so, they have become almost the unsung hero in COVID-19. I think when you look at the news, you always hear about doctors and nurses at the front line. I think pharmacists very much are in that same sort of vein. And I think, from their being a responsible counselor for patients, for them actually being able to refer patients when necessary to follow up testing, they play a role there. And third, it's very important that they themselves are protected as they can actually become vectors for COVID-19. They have such high sort of interaction rates with patients that they can actually spread it. So at mClinica, we've always believed that the pharmacy is very critical to public health. And the problem, though, is that many of these pharmacy professionals and pharmacies are actually very fragmented. And so if you look across Southeast Asia, which is where we operate today, more than 80% of the pharmacies are actually independent pharmacies. These are mom and pop shops that cover urban and rural settings. You have pharmacy assistants and pharmacists and shopkeepers working inside it. And there's a lack of real connectivity within the people and the pharmacy workforce, as well as the pharmacies themselves. And this is really a lot of how we think at mClinica about how you can solve this problem of fragmentation using a lot of what even James mentioned, the power of mobile phone technology. So really, we operate at the last mile, looking at the issues between fragmentation of pharmacies, their ability to reach patients at scale, their ability even to access supplies from a very fragmented upstream supply chain. And this is really where we focus. So how we address this problem is we have an app called SwipeRx. It's almost the flagship app of mClinica. And think about it as an all-in-one app for pharmacy professionals. So we used almost social networking type philosophies from the likes of LinkedIn, Facebook, or WeChat, but applied it to a very verticalized healthcare professional segment that we felt was unaddressed from a public health and programmatic perspective. And what we did was we actually put everything that we believe pharmacy professionals need, and they told us they needed, in one app. So whether it is accredited education, so in every country, pharmacists require a certain number of credits to get their, renew their license. That has largely been offline. We provide a mechanism now that a pharmacist, no matter where they are in the country, can actually take online education and get credits for it. In fact, anecdotally, during COVID-19, we've never seen so many people take the online learning. So obviously there's a big shift towards e-learning as well. Beyond that, news and announcements through content partners like the World Health Organization or university partners, collaboration, their ability to ask questions to one another and support each other in a mobile phone app, being able to do case reporting and referrals. So we do a lot of work in the space of tuberculosis, finding patients who present with symptoms of TB and actually referring them for confirmatory testing, all the way down to participation in research surveys, looking at drug information, adverse events, job opportunities. So what we effectively designed was an app to solve all the needs of pharmacy professionals in one. And we launched this in 2017 and it took off. It really actually grew very fast across Southeast Asia. So at the time in 2017, we were only in Philippines and Indonesia. And then every 2 months, we were able to launch new markets and get to very large amounts of the pharmacy workforce. So what you had is a previously unconnected, very hard to reach, but critical public health workforce that now is all connected through mobile phone. And so we connected over 150,000 pharmacy professionals from about 40,000 pharmacies in Southeast Asia. And when you think about the patient reach that these pharmacies can actually get to, we can reach approximately 150 million patients, right? Those pharmacies are visiting patients each and every day. So this becomes a super critical and powerful channel, whether you are using it for everyday counseling or dealing with a pandemic like COVID-19. So what's also interesting beyond the numbers is that, you know, in all the markets that we operate, more than 25%, up to sometimes 70% of the entire pharmacy workforce is on the app. So for example, in Indonesia, 1 in every 3 pharmacists is on this app of SwipeRx. So it's a very interesting channel to now get to very large material segments of the health workforce. So what happened with COVID-19? So right when the situation was opening, actually Global Innovation Fund, which was one of our investors before, reached out and said, you know, how can we support efforts on COVID-19? And actually, you know, we had a very clear plan in place on what we felt could be very needed to get and amass data in COVID-19, help to drive issues in terms of pharmacy awareness and education, and really solve this problem at the front lines. And so this is a great example of how, you know, a single funder like Global Innovation Fund actually created a spark of catalytic capital. And what it allowed us to do was actually bring together other sources of capital and other technical partners to bear. So we began a multi-country response in Cambodia, Indonesia, and the Philippines, working directly with the ministries of health, then amassing sort of a consortium of partners, Global Innovation Fund certainly, but then adding Johns Hopkins University as an academic technical partner who joined through their Breakthrough Action and Research Project, USAID, who became a funder of Breakthrough Action and therefore some of our work, as well as FHI 360, another, you know, a leading world international NGO. And what happened is it was actually kind of profound being in public health for quite some time to see how quickly capital and partners were able to be organized. And so in a matter of weeks, we were able to kind of put things through very fast sort of application. And I think that was a testament to a lot of donors and a lot of partners harnessing capital in each one of their particular mechanisms towards a common cause and towards that. So now that we kind of, you know, created the coalition and the partners, we started to do work first in Indonesia and now Philippines and Cambodia. But I'll take you through what's actually happening in Indonesia. So the first case reported was on March 2nd. Now there's 24,000 plus confirmed cases, about 1,500 or so deaths. And it's very hard to get accurate counts just generally because of the low testing amounts and actually the just geographic breadth of the country and the health facilities. And I think the government's doing a great job to do that. It's just a very difficult challenge entirely. So how we systematically went after this particular problem in the way that we could was first we run research. We really want to understand what's actually happening at the front lines. What are pharmacies' knowledge, attitudes, and practices with respect to COVID-19? How many cases are they actually coming in? How many people are buying fever medicines? Can we have proxy measures in terms of the data to actually calibrate how big this problem really is beyond what we actually get from centralized hospital and clinic data? Second, once we understand that, we also know what to target in terms of directed awareness campaigns. So just like, you know, you can target ads for particular areas, we're actually able to target public health awareness campaigns on particular deficits in knowledge and awareness gaps that we identify from the research. And finally, we can do structured education with respect to actually teaching formal education online. And because, you know, all of this happens digitally, their ability to actually drive at research all the way to awareness to education is very possible. We even do now work in supply chain, allowing pharmacies to actually access their goods. And I'll tell you more about that as well. So what do we find? And I think this is actually pretty shocking from the front lines. So in that first phase on research, what we understood is that patients who potentially have COVID-19 are actually visiting pharmacies, and they're visiting them sort of for these critical services. So 50% of patients actually seek advice on COVID-19 at the pharmacy. So this is, very critical role that the pharmacy can play in patient counseling and advice. And in an era of fake news, and certainly in Southeast Asia, this is a big and prevalent problem, people trust their healthcare professional. But if the healthcare professional doesn't have the accurate information, that's a big problem. 39% of patients actually complained about COVID-19 symptoms. So they're visiting a pharmacy complaining about COVID-19 type symptoms. They're actually lost to the whole health system generally. You may never see them, as James said. They might stay at home and keep it to themselves, if you will. 50% of them bought actually fever or cold medicine during the period of observation. So if you look at fever medicine as a proxy, it's not the best proxy, but it is one way to look at sort of an indication of COVID-19. What all these kind of data points tell you is that it was a very severe challenge, especially in the first weeks of April. Beyond that, if we understand now that pharmacies are critical, they are receiving these patients are presenting with symptoms, they are looking to pharmacies counseling. Are pharmacies really prepared to even give this knowledge? And what we found is that 53% of pharmacy professionals actually got the symptoms of COVID-19 wrong. 96% got the criteria for rapid testing wrong. 70% got the criteria for hospital referrals wrong. And so what this tells you is that if you have a pharmacy workforce that is seeing patients, that is the trusted authority, but they themselves do not know the right answers, then how are we ever going to be able to solve this problem for the patients who are susceptible to fake news or will never see a doctor during this time? And this underscores the criticality of pharmacy professionals. Even more so, if you dive deeper, when it comes to access, I think when people think about COVID-19, part of it is PPE, but actually basic access to medicines has been affected. Your access to hypertension medicines, diabetes medicines, all of that has actually affected in the supply chain. And 81% of them actually reported a lack of medical supplies from wholesalers and distributors. So why does this happen? Well, wholesalers actually run lower shifts. They actually don't have enough people. Logistics is affected. There's less people actually moving it around. Even upstream, all the way from production, most of the API in the world, the active pharmaceutical ingredient, comes from China. Some of it comes from India. If they're not working, how does the product actually end up in a pill that ends up in Indonesia? So all the way upstream, there's actually a massive problem in terms of distribution. And so, by understanding the pharmacy professional, they're able to pick this all up. We also understood that 83% of staff at the pharmacy reported a lack of PPE. So think about this. This pharmacist is interfacing with more patients than probably anyone else during this time on a regular basis. And if they don't have their own protection, they can become massive vectors for this. So all of this first phase of research helped us to very quickly, and I think we got the data back in about 4 to 5 days, so very rapid, we were able to get a statistically significant national sample, all delivered digitally, to really understand very, very rapidly what was going on. Now, as a result of that, we're moving into very quickly the action phases, which is targeting particular gaps in awareness and education for pharmacy professionals, putting in content that's directed with the help of Johns Hopkins, FHI 360, USAID, and the other partners, and then driving actually formal education. We have also helped to make supply chain more available by allowing greater numbers of wholesalers to be there, scouting all the wholesalers to make sure supply is there, and allowing pharmacies to have extended credit to actually do their purchase facility. So I think, all of this gives you an idea of perhaps what is sometimes referred to as the unsung hero in public health, the pharmacist. But I think this data really underscores their importance and also how you can address these issues using digital interventions during a time of pandemic. So I will stop there, but it's been great to share with you some of this. I will share with you one last slide, which is particularly powerful. And I think, when you think about this, given the increased risk rate, what is actually incredible to me is no pharmacist has ever said, I don't want to work during this time. they continue to go out just like nurses and doctors and continue to serve. And they see it as a moral responsibility and an ethical and professional responsibility to do so. And it's because of people like this that no matter what intervention or education or awareness, you actually have somebody who's present in the shop to actually, help that patient who serves. So I think that's a pretty powerful statement from the pharmacy professional heroes here.
Thanks so much, Farouk. That was a really pretty dramatic example or description of the central role that data and knowledge sharing has in response to a crisis. And again, we're seeing not just in low-income settings in Indonesia, we're seeing in lots of parts of the world that the absence of that data, the absence of confidence in the data, and certainly the absence of easy access to the data is hindering everyone's ability to respond to the crisis. So I think that's really an overarching issue that you've raised. We're starting to get some really interesting questions coming in on YouTube. So I had a few myself, but I think I'm going to jump to those questions so we can, because I think actually the questions are picking up on a number of points that a number of you have raised. And so I'm going to pose it, and anybody on the panel who wants to respond should jump in. So the first one is, it has to do with the roles of the public sector and the private sector and how they can be combined effectively. And in particular, the question was, you have these these impact investors like the Global Innovation Fund interested in financing innovation and social enterprises. And then you have the governments out there. And how can they work effectively together? I think both in the crisis response and the recovery phase. So I mean, it's almost like if you had your wish list of what governments could do in concert with the private impact investment providers, what would you be asking them to do? And this really relates to, I think, what all of you have been saying. So any thoughts on that from anybody?
So I'm happy to jump in first, even though I do think that what Farouk just laid out in some ways kind of makes this point quite clear. So on the one hand, I think what the impact investors and the private sector bring are essentially kind of an ability to take kind of important risk and to generate some powerful learning, and as sort of Josh said as well, kind of at the last mile of kind of this interface between the population and the system. And in some ways, what I think the response, at least in terms of being able to address kind of the public confidence problem, requires is both a kind of the messaging, which I think may be more effective, or depending on where you are and which organizations are essentially kind of are most trusted. That the public sector may in fact be that organization that you want, but the public sector doesn't always have the network. It certainly doesn't have kind of the sometimes the data and kind of, I guess, the pretty granular information that they need to act. And so so think about sort of Farouk's kind of example of the pharmacist being kind of the trusted organization, but not knowing what the testing protocols or essentially kind of hospital referrals are. It strikes me that this may be the one opportunity, even though in the general research we have lots of concerns about kind of the private-public gap. I think this may be the one context where both of these actors can come together and actually sort of, in some ways, bring out the best of what each of them does well, which is the legitimacy that the public brings, but also essentially kind of the data and flexibility and versatility that essentially kind of private actors can provide.
Thanks. Maybe Josh, I can sort of particularly highlight the relevance to something you said, which is the cost of capital matters a lot in an environment where risk is skyrocketing, and there are a lot of capital providers in the formal sector, they're going to be retreating and concentrating only on the highest returns. So what does that say to you in terms of what public providers of finance should be doing at this point?
I think it's clear that there's a huge group of the demographic that you can't serve, or you couldn't serve before and make market rate returns. And so now I think that group, when I think about what we're doing, has increased massively. So if I take our business model, for example, like it was predicated maybe on 5% default rates of businesses, for example, right? Because we could predict the risk, we could analyze it, and we could support them to avoid that. Now, it might still be 5%, but there's so much uncertainty, it's probably going to be less, and it makes it very, very hard for us to predict it or model it. And so I think it's unlikely that those private flows of capital, if they still want those same returns, are going to be able to invest there and work there. So I think there's therefore a huge role for public money to come in and support entrepreneurs that are trying to work with those lower margin groups, where broadly you have people that are, more at risk, and probably, falling deeper into poverty. To come and support those organizations so that they can deliver those innovations and support them. I don't know the mechanisms, how that would come about. I think Alex is probably much better placed to do that. But I think without that, the flows of capital are going to dry even further up. And we're already seeing it, say, in Uganda and Kenya. The banks are really shutting down in terms of who they want to invest in. Like, we had clients before that would have been able to get some bank loans, and now they're really, really struggling to do that because the banks just can't price the risk and they can't manage it.
Yeah, and Alex, maybe you do want to come in on this, and it comes back to your point that you made earlier on the risk-adjusted return targets and also your deployment of subsidies. So how do you think about that? And I think the other point is, how do you decide between liquidity and solvency issues in this incredibly uncertain environment?
Yeah, thanks very much. I think we are getting to exactly the right questions here. And as Josh said, if it's really impossible to accurately price risk at this time, you see why James's comments about the need to increase confidence is so central to this. We really can't separate out the public health response and the ability to get capital flowing again. I think from GIF's perspective, we do spend a lot of time thinking about, is this firm on track for impact, but at a different rate? Can they survive through this? Is it a liquidity crunch? And in fact, the impact is there, or is this a solvency issue? And part of how you need to do that then, and this is how you think about allocating subsidy, is by being pretty good at measuring impact and being pretty clear-eyed about the extent to which there are trade-offs between impact and financial returns. So at GIF, when we make an investment, we estimate what will be the social value generated by that innovation 10 years from now if they're able to reach scale. And so the financial sustainability in any business is a means to that end of delivering on that impact. And so that's how we begin to hold those two things side by side. It's the same analysis now, just needing to think carefully about whether the pandemic has changed the potential for impact at the same time as it's changed the potential for sustainability. One thing that would put an impact investor perhaps on a different footing than a traditional commercial investor when you're thinking about how to support your portfolio companies is whether this is a time to really squeeze on valuation because the company is desperate for cash, or whether you're going to take a more reasonable approach to that is going to support a long-term sustainability. So that's, not necessarily quantified as a financial concession, but in practice it really is if you're taking a view of being a patient long-term partner with the firms you're working with. I also want to highlight the kind of stuff that Balloon Ventures does. The support for helping firms to professionalize and break through the barriers that take you from I employ 20 people to I employ 200 people. I think why GIF backed Balloon Ventures is we think that's actually critical to the health of the ecosystem of firms more generally, whether they're innovations or brick and mortar standard SMEs. And so I think there's an interesting conversation for us all to have about how do we build up more Balloon Venture style support as we think about recovery. And then, of course, last, firms do have to pivot right now. New investors are not going to have the appetite for understanding this new business line. It's only existing investors who know firms well enough that they can assess and support that kind of pivoting. So I think we need to think about stepping up the capital available to investors who have already deployed money and making sure that they can deploy more, as opposed to only thinking about new COVID-specific vehicles that are going to be sort of starting from ground zero.
Thanks. And maybe we can come back to this trade-off between deployment of public resources for governments versus for mobilizing private finance. But first I wanted to turn to Farouk for a second because we have a question from YouTube, our YouTube audience, that I think relates to a lot of what he said, which is closing the digital divide and the financial inclusion aspect of that seems so critical. The access to mobile information, mobile services, and it's critical to your business model. What do you want from governments in that context? In other words, should governments be providing some incentives to the tech sector or the health sector to either broaden access to these digital services or somehow lower prices? What would you want government to do?
So I think I'll take this from two approaches. One is a general infrastructure. Certainly investments by governments in telecommunication, are just as important now as roads were, right? And I think this is very important as you start to expand access across a country. Would we think that there needs to be differential investment in us from a government to do so? We don't think so. I think the government should better use it for the general population and to build essentially the pipes that everyone can use. I think from our perspective, how we marry the worlds of public and private sector is this. We look for the common problem and challenge that both have. Then harmonizing public sector and private sector funds or programmatic activities from either become quite easy to do. And for us, it was the pharmacy. We thought that this was a very hard area for not only governments and NGOs to access, but also pharmaceutical companies. My actual background's in the public health. I used to come from an NGO background. I also worked in the private sector. I thought both had its own issues. And so the idea was with common problem, how do you solve this issue of pharmacy fragmentation? And then how do you look at it and say, well, pharmacies look at a variety of disease areas, not just ones that are commercially interesting, but ones that are interesting to public health. What I mean by this is that, let's say you look at it from diabetes or hypertension. There are enough pharmaceutical companies that want to do research and awareness and education on that. But who picks up TB? Who picks up HIV/AIDS? Who picks up COVID-19? This is squarely the remit of the public sector. And so there is kind of this end-to-end broadened coverage. And if our vision is to say that pharmacies should be equipped to solve any disease, regardless of whether it is commercially interesting or not commercially interesting, because it's what matters to the patient, then figuring out how you are going to provide that broad spectrum becomes important. And then these two sides kind of harmonize because, for example, in COVID-19, no pharma company really wanted to step in there and do that. That's the remit of the public sector. But for hypertension, diabetes, there's enough. And that way you can have this living sort of social enterprise model that has the ability to scale, that has the ability to serve both audiences, that works with the government, that works with the bilaterals, that works with the private enterprise, and does it in a way that's far more sustainable. One thing I learned is that, in public health, when you read everything is a pilot. And does it ever get out of that? And how do you actually get to scale? And scale is a matter of sustainability. And I think this is why very much impact capital was created, to try to find models like this. This is why now you even see USAID and its language change to journey of self-reliance, engagement in the private sector, because that is effectively the model. But it's how you put the two together in a way that makes sense that is really kind of the piece that we think a lot about.
Great. Yeah, I think that's really helpful. But it's quite complicated as well. I think, James, it might be nice to bring in education into this conversation. We've talked a lot about health and behavioral change in health. But, this could easily have long-term, implications for delivery of education services. So, what are you thinking now in terms of the behavioral research on education and how the pandemic may have long-term consequences?
So thanks again, Nancy. No, this is also an area, I think, of both active research, but also some really interesting innovations. I think, as Farouk has already sort of described, their app is providing this continuous professional development. And so people are starting to, I think, start to get used to kind of being able to learn remotely. Lots of governments have been standing up a lot of sort of broadcast instruction. So the radio may not be great. People are using television. All of these, I think, are still at a very early stage of kind of being well optimized. And I think that what's quite powerful, and we could also talk about some of the other, one of the projects that the GIF is funding, sort of education initiatives in India, has suddenly been doing a lot of really interesting work about sort of personalizing education for kids. I mean, so we start from a very, very low base in terms of kids' competencies around the world. And there's certainly been quite a lot of research suggesting that, in fact, providing very well tailored education, teaching at the right level, and so on, and making learning sort of more exciting, certainly kind of seems to have a huge impact on sort of what kids are able to do after a few years exposed to this. So I think this is, in some ways, the pandemic provides an opportunity for essentially kind of even greater investments in this direction. I think it's too early to tell whether this in fact will supplant kind of the traditional model of schooling. That traditional model has been pretty robust to kind of many waves of new technologies. So in some ways, I don't think that's going away. But I think what's comforting to hear, even from governments, so I do a lot of work closely with the government of Tanzania, is that whatever they're standing up now, they essentially kind of want to keep in place going forward. And so I think a lot of these new solutions will be sort of complements to the traditional model, even if it stays. But we certainly do need to do a lot more to make them effective. So, teaching reading over the radio is just something that's going to be very, very hard to do. One way sort of communication is just not enough. What we want in some ways is to almost essentially kind of build two-way essentially kind of channels to kind of leverage a lot of this natural language processing technologies that are sort of emerging, and sort of combine them with some of these really innovative kind of ways of pedagogical strategies, and actually sort of produce kind of, I guess, durable and effective solutions where a kid can call in, see a letter, pronounce it, get feedback that that's the right letter, see a word, read, and so on, and actually even be assessed kind of remotely. I think those things are possible. And in some ways, I'm actually sort of quite confident that we will see that the pandemic will, in fact, catalyze essentially kind of the incubation of these technologies.
Yeah, I mean, I have to say, just being in DC, the reaction to remote learning on the part of at least all the parents I know has not been overly favorable. So the model is clearly going to have to be adapted. Question for both Josh and for Alex, which is, you've talked a lot about how you are thinking about and trying to support your existing investees and clients. So does that sort of imply that this is a moment to kind of retrench and not do more new investments or new support efforts? In other words, how are you thinking about new clients at this stage? Is that even on the radar screen? Because I think, as both of you mentioned, or at least Alex mentioned, there are some businesses that are, most businesses are highly damaged by these circumstances. There are some businesses with huge new opportunities. So from a portfolio perspective, you could, and you could think of it as you're trying to help your existing clients, which are hard hit, but then there's some other people out there that you might want to help that could benefit and grow very substantially during this period. So maybe Josh first and then Alex.
Yeah, I think we're probably taking it slow at the moment, slower than our investment directors want to go. So Oscar in Uganda wanted to assess 3 businesses tomorrow. I think what's interesting is, rightly or wrongly, they're like pretty bullish about things getting back to normal fairly soon. And I'm not sure if that's the right response or the wrong response, but there's pretty much a feeling among businesses, among our staff, that like, give it a week or two, the lockdown is easing, and things are going to reopen again. So yeah, we've got new businesses coming to us. There's ones with like contracts with governments, for example, building roads, that are starting up again. There's one that makes like pumpkin flour, where there's like big demand for it. So we are looking at them. I think the big challenge for us is, especially in a context where financial record keeping is so poor, and it's one of the things that we really focus on, trying to get decent accounts to actually have visibility of what's going on in the business. Without that, when you have new clients coming to you, it's very hard to understand whether they actually need the money for the project that they're proposing, which might sound brilliant and there might be a very strong investment thesis for it, or whether they just have like real liquidity issues and they owe lots of money here, there, and they're really struggling, and so they're just trying to get money from different sources. So that's a continual battle to really, that we're fighting. And I think countries like Uganda and Kenya, a lot of people and businesses are already very indebted. So people already have large loans that are being restructured by the banks and other investors, but people have a lot of obligations to pay. So yes, we are like looking at stuff, and there is exciting stuff that's coming through. I think at the moment we're just, like, as I said, we're trying to step a bit slowly because of this uncertainty that I mentioned. Like, it's very hard to predict what's going to happen in 3 weeks, 5 weeks. You don't know whether there's going to be this like a prolonged period of social distancing. At the moment, there's not huge amounts of transport between towns and cities. We don't know whether that will open up again and then close. And so I think for us, it's like a case of trying to take it slow. That will mean that there are businesses that need support that might not be able to get it quickly enough, and there might be other models that can work for that. But I think when we're investing fairly large sums of money, $15,000, $20,000, $25,000, like, we can't really afford, especially at the stage that we're at, to like take those huge risks and risk losing that, unless there is other sources of capital that comes in and says, you know what, Balloon Ventures, like, sure, go for it. Like, we're going to accept in this context 25-30% default, because actually the returns, the social returns that you're getting are really, really valuable. Just on then supporting our existing portfolio, it's easier then, right? You have better visibility, you know what's going on in the businesses. You're working with the entrepreneurs, like you've seen it with them and you've been through it with them. So yeah, we're already deploying capital to some of our existing enterprises to support them through this.
Great. That's helpful. Alex, what's your view?
I think it's quite similar to Josh, maybe on a different scale. We did announce a new investment very recently in a company in India called Kamatan. And they work to connect and strengthen agriculture supply chains and get small-scale farmers access to better prices in wholesale markets. And so that's important right now during COVID, but it's also going to be very important in terms of recovery, and there'll be real opportunities there. So we are trying to be smart when we think we can get in on investments that will deliver impact relatively rapidly in the recovery phase. We want to be able to seize that moment now. We're also continuing pretty actively scoping out a pipeline in the space of early childhood education. We think that's going to be really important. If, well, James, as he mentioned, while we figure out the new world of education, we don't want kids entering the primary school without the basics that you need from the ECE stage of life, especially if we're still trying to figure out how to new ways of doing schooling. So we are on the lookout for impact, but it's difficult. You can't do the kind of due diligence that you traditionally do. And we want to build up a pipeline so that we don't have a long lag when we can start deploying capital more rapidly again. But we need new ways of working and new ways of collaborating between investors as well. And so there's innovation to be done just in how we work as we go into the next phase of the crisis.
Thanks. Which I think is a broad theme in this conversation, which is, to me, reinforces the value of investing in innovation and in adaptation, and perhaps the strong driving forces during a crisis that almost force innovation, confirm why that's important for the public sector, and why that's a strong rationale for resource allocation by the public sector to the private sector, to private innovators, as opposed to focusing all public resources on simply helping governments finance their greatly increasing expenditure needs. So I think that's a theme that came out of this conversation. We only have about 3 minutes left, so I thought maybe I would give everybody an opportunity to say one last word before we sign off. Anything else that you want to point out or reinforce in what you've said? Anybody can go first.
Sure, I'll go first. Yeah, I think I just reinforce our message of don't forget about the small businesses. I think, like in our culture, we kind of celebrate these like rock star entrepreneurs that are raising loads of money and scaling. But actually, the reality is that the vast number of jobs and good quality jobs are provided and will be provided in small businesses. They're really, really struggling at the moment, and they're going to be absolutely critical to the long term, like economic and personal health of what happens over the next 12 to 24 months. So let's not lose focus about how important this group is just because they're not very visible and you don't see them on front pages of newspapers and magazines and things like that.
Yeah, exactly. I think that's a great point. Anybody else?
So yeah, perhaps I'll jump in. So I think I would. It's been great. Kind of being on this panel. It's really kind of nice to sort of listen to Josh and to Farouk and Alex, who are essentially kind of supporting this kind of incredible innovation. I would really only just like to add and say that we need to be creative. We need to act quickly. We need to be local, and we need to learn as we do. And I think as we essentially kind of roll out these solutions, it's really important that we actually sort of generate some reliable evidence about exactly sort of what is working and what isn't working, and to share that quickly, because we all need good solutions.
Yeah, I'll just build on that to say this is a conversation that we're all going to have multiple times, and to figure out, platforms in which we can share information with each other across contexts about what we're doing, and being transparent when things work and work less well than we had hoped before. But thank you so much to everyone. I learned a tremendous amount today. It's great fun. And thank you, Nancy, for ably steering this Zoom ship for us.
Well, this is
thanks to everyone. It was great to be with you today as well. So it was very enjoyable.
Yeah, no, this has been an absolute pleasure, and I think a very useful conversation between people with very helpful perspectives and different perspectives on these problems. And I absolutely agree with Alex. This conversation needs to continue, and the sharing of lessons and experience is really important, because we are really at the beginning of this, what may be a kind of structural shift in a lot of aspects of the global economy, in both developed and developing countries. So thank you so much to our panelists. Thanks to the audience for great questions, and to be continued. Thanks, everybody.